So what's the plan once the center is up and running? How are you going to manage the center from Cincinnati?
Right. Well, we do have a partner organization in Tanzania called the Sharati Health Education and Development Fund, or SHED. This is basically a group of folks that have been with us from the beginning that said, you know what, we believe in what you're doing. It's Tanzanian folks that basically help carry out our mission and the work on our projects year round. So even though Village Life might only take 2 or 3 trips to the region a year, we have a permanent 24/7 presence in our 3 target villages. So SHED, our partner, is going to pretty much run the day-to-day operations of the health center. We intend for it to be fully run and staffed by Tanzanian healthcare professionals. We obviously want to have the ability to send our folks, students, residents, doctors, nurses, pharmacists, and all types of folks from Cincinnati to go work there and do a rotation for anywhere from a month to 6 months or a year. But we really want this community to embrace this facility, which they already have, and we want it to be run and managed by them.
Okay, so let me ask you this. When you go over on your trips, where do you stay?
Well, our partner organization, SHED, they provide wonderful housing for us.
SHED, right?
They provide a shed, yes. You know, the conditions are meager. We stay in facilities where you're taking a bucket bath, off and on electricity. We're eating the local food, sleeping under mosquito nets. But, you know, it's almost like a camping trip, and we've been fortunate to have a lot of great Cincinnati volunteers. We've taken, since 2004, we've taken hundreds of Cincinnati folks to Tanzania, and we haven't had a complaint yet.
And again, in case you're just tuning in this morning, you're listening to Sunday Morning Magazine. I'm Rodney Lear. This morning, I'm joined by Dr. Christopher Lewis. He's founder and president of Village Life Outreach Project. Now, earlier you mentioned AIDS, but when we talk about Africa, we often think about the AIDS epidemic there. You talked about malaria, but let's talk more about the AIDS epidemic in Africa.
HIV infection is tricky over there. It's about 10% are the current numbers in the region of Tanzania where we are. The country as a whole first gained access to medications to treat HIV in 2007. So it's been less than 3 years that they've even had medicines in the country to treat this disease. When you combine that with poverty, people not having the ability to take care of themselves, limited educational campaigns, no access to condoms, it makes it very, very tricky to treat. We do a lot with AIDS-related conditions with Village Life where we're treating secondary infections, but the proper treatment of HIV in the region is now going through the hospital that I worked at in 2003, where they're doing a lot of directly observed therapy where people come every day to get their medication, and the government is supporting that. But it's a really tough struggle, and every few months a friend of mine in Tanzania dies from HIV, unfortunately.
And for those that are listening this morning, there are several ways that they can help make a difference with the work that you're doing in Tanzania. And one is through a coffee project. Explain to us exactly what that is.
Yeah, we partner with Coffee Emporium, a local coffee company here. They import coffee directly from Tanzania, from the Mount Kilimanjaro region. The Tanzanian pea berry is what it's called, Village Life Tanzanian pea berry. There are 3 flavors, dark roast, light roast, and a decaf. You can get it on our website at villagelifeoutreach.org or at any Coffee Emporium location. All proceeds from coffee sales support the building of the health center called Roche Health Center that we're building in Tanzania, and support that nutrition project where we feed 1,200 kids a day. It's delicious. I drink a cup every morning, so I encourage your listeners to go out and try it.
All right, good. And so you would know that you're drinking a good cup of coffee and you're helping someone as well.
Helping Village Life, help thousands of villagers. And again, we couldn't do it without our wonderful partners at Coffee Emporium here in Cincinnati.
Okay, so the Coffee Project is one way we can help support your mission in Tanzania from right here in Cincinnati. What else can our listeners do?
Well, it's very easy to get onto our website for those who have computer access. It's villagelifeoutreach.org, or you can just Google Village Life and we'll come up. They can also call me directly at 513-584-8630. We're always taking donations of time, money, support, anything that you can think of that can help. We can probably put it to good use.
All right. And Dr. Lewis, give us the phone number and web address again, please.
It's villagelifeoutreach.org. villagelifeoutreach.org, and the phone number is 513-584-8630. We are a registered 501c3 nonprofit organization, so any financial support that we do receive is 100% tax deductible. All of the money that we get from public donations, 100% goes to the work on our projects, and we're very thrifty when it comes to getting work done over there.
And Doctor, we were talking about this off air, but explain to our listeners how little it takes in terms of money to help make a difference.
Very little. We can buy a mosquito net that can prevent a child from having or dying from malaria for about $6.50. We feed 1,200 school children every day. These are kids that were coming to school without breakfast. There's no lunch provided at school. A lot of them have to walk anywhere from 1 to 3 hours just to get to school. So they're pretty much going to school on an empty belly and getting fed when they get home, one meal a day. Since instituting our nutrition project, where we're feeding 1,200 kids every day, we've seen standardized test scores increase 30%. Attendance rates at school have increased 25%. The kids are healthier. The school that we have this project at has gone from the lowest in the region to the highest rated school in the region. A little bit of support can go a long way over there.
All right. Well, thank you so much for taking the time to talk to us this morning. And thank you so much for all the work that you're doing over there.
Thank you for having me, and I appreciate you having me as a guest.
We've been speaking to Dr. Christopher Lewis, founder and president of Village Life Outreach Project. Again, the website is www.villagelifeoutreach.org, www.villagelifeoutreach.org. We'll be back with more Sunday Morning Magazine right after this.